Ladies and gentlemen, good evening to you all, and and welcome to Tanoa Hotel Suva. It gives me great pleasure to be officially launched the Tanoa Hotel Group Pinktober initiative, and also I believe today is the 1st of October, launching nationwide. And I welcome all the corporate executives and representatives that are here, and most importantly, Tanoa Hotel Group for organizing this. Thank you for all your efforts in ensuring that none of our people living with cancer shall ever fight alone. Our government is very keen to take the health services to another level. What we believe in is the 3 pillars of universal health coverage, and they are: number 1, we will reach the unreached, we will leave no one behind, we will decrease the out-of-pocket expenses for all Fijians who access health services. And to that, I would like to acknowledge the strength and determination of those cancer survivors who are out there, irrespective of whatever cancer they have. Their resilience and your resilience is a pattern to us all. Your victory will become a footprint to countless others who will walk the battlefield in the future. We have 17 million new cases of cancer worldwide, and the mortality is about 9.6 million deaths from cancer in 2018. Worldwide, lung, followed by liver, stomach, and bowel cancers are the most common causes of cancer. In Fiji, it's breast cancer, cervical cancer, then followed by gastrointestinal cancers, and then lung cancer towards the bottom. It is predicted that by 2040, there will be 27.5 million new cases of cancer. So the incidence keeps on rising. And in Fiji, breast cancer is about 300 a year, 250 to 300, followed by cervical cancer at less than 200. And there's been a steady rise in the incidence. And as I've alluded to in another discussion earlier, that because we now have available a HPV or human papillomavirus vaccination that's given to our daughters at about 13, that trend with cervical cancer, we believe, will plateau off and hopefully reduce. Unfortunately, breast cancers do not have a vaccination. The National Health Service in Britain has shown that there was an increased survival trend in the late 90s. And this was attributed to the many armories that are available in the management of cancer. Apart from operations, there are now newer and also adjuvant therapies such as chemotherapy and radiotherapy. And as Minister for Health, I've seen over the last 20 years, as a clinician and now as a minister, the growth that we have had in the management of cancer. And for that, I'm very excited for the cohort of health professionals that are working in this area. Some of them have returned from stints overseas, including our own first medical oncologist in Dr. Ifereimi. Last week on Friday, there was a conference that was held in one of the rooms up here, where doctors from all around the Pacific that deal with cancers, especially the treatment around chemotherapy, were discussing about best practice. I've also had the opportunity to work with the Fiji Cancer Society, and I'm very excited to be here to support the cause. Whilst the Ministry of Health and government takes it upon itself to look after patients with cancer, provide treatment, provide appropriate screening, it is the Fiji Cancer Society that supports our work through the soft components, such as reaching out to them, providing taxi fare, providing counseling, helping with stoma bags for those who have colorectal cancers. So we work hand in hand. And this arrangement is similar all around the first world, where we have governments and ministries of health and health facilities providing the treatment and support from other agencies and donors and non-governmental organizations. What I'm also very keen to talk about today is the fact that today is a reason to come and celebrate, but more importantly, the most important reason about today is the awareness around cancer. As I think about over the years, and I think about cancer and what Pinktober means, next month is November, in which we have awareness around prostate cancer, and the men will wear blue, and that's why I'm wearing blue today, so as to remind us that next month, please don't lower our guards. We must remember men and prostate cancer. Pinktober is about the women and the men that have passed on with cancer, but more than that. Pinktober is about those who have cancer and undergoing treatment or in remission, but it's not about them only. Pinktober is also about people who manage patients with cancer and support people with cancer like Fiji Cancer Society. But that's not limited to them. Pinktober is about you and me. Those of us in this room who are well. You must remember that all of us in this room are susceptible to cancer. And the data has shown it, that we are all susceptible to cancer. Only God knows who will have it and who will not. So whilst we remember those who passed on, whilst we remember those who have cancer, whilst we support the work of the Minister of Health and the Fiji Cancer Society, Pinktober is about us. It is about us making a health selfie of us, looking inwardly and ensuring that we have the appropriate checks while we're still well to know whether we have cancer or not. I thank you once again for this opportunity. I thank Tanoa Groups of Hotel, and I thank Fiji Cancer Society for all their hard work. I want to finish by saying the mammogram does work. It's been working throughout since May. Please, for those who need mammograms, they can have a mammogram. Laka.